We're at 4 o'clock Greenwich Mean Time. Good morning to you all. Very warm welcome back to the final session of this first part of the UHMLG Spring Forum. I'm really delighted to give a warm welcome to Jane and Lauren, who are speaking to us from Florida this morning in their time, trying to acclimatise myself to the right time zone. And I'm very pleased to have them join us. Again, please tweet with the hashtag UHMLG22 and do have a look out for the evaluation form, which is going to be winging its way into your inboxes shortly. We'll be very, very pleased to have your comments and feedback. But the final bit of the Spring Forum is going to be all about integrating diversity, equality and inclusion principles into instruction. And I'm going to, without further ado, I'm going to hand over to Jane and to Lauren and give you a very warm welcome and get those questions into the chat. We're looking very much forward to hearing the experiences and the learning from the University of Florida. Thank you so much.
Thank you. Good morning. Hopefully you can all see my screen and I'm good to go. Okay.
It's all perfect.
Pardon?
It's all perfect. We can
okay, wonderful. Thank you so much. So I'm Jane Morgan-Daniel. I'm the Community Engagement Librarian at the University of Florida. And I'm here with my colleague, Lauren Adkins, who is the Pharmacy Liaison Librarian. And my other two colleagues, Hannah and Mary, were supposed to present with us today, but unfortunately couldn't attend. So we will be presenting their sections on their behalf. So this session is structured around 4 case studies that highlight how the University of Florida's Health Science Center libraries are approaching inclusive teaching through intentionally incorporating diversity, equity, and inclusion principles into our instruction practices. First, we'll provide some brief background on our library. We'll talk a little bit about how we're defining inclusive instruction and pedagogy, and also about critical librarianship and critical instruction as concepts. Then we'll get to our case studies. I'll talk about an annual workshop that I collaborate on for physical therapy students about health literacy and its association with patients' diverse identities. On behalf of Hannah, Lauren will discuss a Librarian-Taught 1-credit course for public health students, which was revised to create a more inviting syllabus and to integrate elements of universal design. For Mary, Lauren will also talk about an annual project that Mary's involved in for first-year medical students in their Health Outcomes and Policy Intensive course, which involves highlighting health disparities and community resources. And then finally, Lauren will talk about her own case study, which is piloting the application of critical librarianship principles into library workshops. First, some background on the University of Florida's Health Science Center libraries, otherwise known as HSCL. We're an academic and a clinical library serving 6 health science center colleges covering dentistry, medicine, nursing, pharmacy, public health and health professions, and veterinary medicine. We have 2 sites, one on the main University of Florida campus in Gainesville, which is in North Central Florida, and then a library based in a hospital in Jacksonville, which is in Northeast Florida. And we have 17 librarians and 8 staff across both sites, and we're part of the University of Florida's wider library system called the George A. Smathers Libraries. Although the librarians at HSCL have always strived to make their instruction sessions welcoming for all learners, we've recently begun to intentionally incorporate diversity, equity, and inclusion principles into our teaching during both design and implementation. Inclusive instruction seeks to create an inclusive learning environment for all students, and one approach to inclusive design thinking is to consider these questions. Ask yourself how your cultural assumptions influence your interactions with learners. How do their backgrounds inform their engagement in your instruction? And lastly, ask yourself how you can modify your course, like its materials, activities, assignments, and assessments, to be more accessible to all learners in your class. The team is also starting to integrate critical librarianship perspectives into our teaching practices. Critical librarianship encompasses DEI concepts, as well as elements of critical theory, critical literacy, and critical information literacy. Critical librarianship is critical in that it is critiquing the profession by pushing it to be activist, self-reflective, and questioning the nature of knowledge in the field. The belief that libraries are neutral is not illustrative of critical librarianship. Libraries and librarians should not be neutral. They should seek to transform and empower, constantly challenging existing power structures. Some examples of critical librarianship include using information literacy instruction sessions to empower learners to use information to push against the boundaries of traditional power and privilege. Now on to our first case study, which provides an overview of an annual health literacy workshop on inclusive patient education materials for physical therapy. The workshop idea developed from a chance meeting with a physical therapy faculty member who was looking for collaborators with health literacy expertise for an annual workshop that she'd recently begun running as part of the Doctor of Physical Therapy program. She was specifically looking for someone to teach how to find and assess patient education resources for suitability, while also considering health literacy as a central concept. I, as the health literacy librarian, of course, offered to collaborate. The first iteration of the workshop with me as collaborator took place in person in 2019. The guest lecture component lasted around an hour, and the follow-up lab, which is an opportunity for students' hands-on activities and practice, took place the following day. And the same format was used in early 2020. But by 2021, COVID impacted the in-person format, so we transitioned the class to Zoom using a flipped classroom approach. We had the students watch a pre-recorded version of my guest lecture, and then we used breakout rooms for the group activities component, but we found the lack of a larger group discussion option a hindrance. So this year, we still offered the session online with the guest lecture recording as required viewing before attending, but we had breakout rooms for a shorter time period, followed by polls and group discussion. And we felt that that was successful, and we plan to use the same format next year. The guest lecture component of the collaboration centered on finding and assessing patient education materials suitable for people with low health literacy through the lens of diversity, equity, and inclusion. In terms of content, I opened the session by talking about how, as future practitioners, the students have the opportunity to empower patients to make positive health choices and share in the health decision-making process by not only making sure that patients have the health information that they need, but by making sure that the health information they give them is actually readable, understandable, and actionable. By thinking about inclusivity, students can help facilitate a shift away from a more traditional view of patient education, where the provider talks at the patient, to an education process that's more conversational and participatory, that actually takes diversity categories, intersecting identities, and health disparities into account. With this in mind, I ask the students to think about examples of diverse identities that may influence a person's ability to achieve good health due to systemic inequities. And we usually touch on things like the patient's age, race, ethnicity, disability, or ability status, to name just a few things. I always remind the students that a person's identities tend to overlap and intersect, meaning that everyone is different. And we then talk about how patients' intersecting identities often influence their health beliefs, which therefore impacts health behavior and health outcomes. Next, we talk about how the populations most at risk for low health literacy and associated negative health outcomes tend to overlap with diversity identities, because environmental, social, and personal factors all play a role in an individual's ability to navigate the health system and to make healthcare choices. Often, patient education materials make unreasonable demands for people with lower health literacy levels. So I talked to the students about how choosing culturally inclusive materials designed for low health literate populations, helps level the playing field because it increases the chances that patients will actually understand and act on the information that they're given to change their health behaviors. Next, I provide some examples of quality patient education resources. I don't want to spend too much time on this slide because the resources are very US-centric, but just so you have some idea of the kind of resources I cover, these tend to include Medline Plus, which is a consumer health resource by the National Library of Medicine, the Merck Manual for the Consumer, and that's in case people don't want to use a government-funded resource, which we get asked about quite a lot, and Ethnomed, which contains medical and cultural information about immigrant and refugee groups. And the final part of the guest lecture covers how to evaluate the suitability of a resource through thinking about the patient's diversity-related identities and specific health goals. First, thinking about trustworthiness, we talk about using Medline Plus's Evaluating Internet Health Information Checklist to consider source reliability. Then we think about readability, defined as, is a resource easy to read? And there's no universal way to measure this. It's generally by reading level or school grade level, which can be calculated in different ways. And the tool I recommend is the readability test tool on the slide, as you can paste a URL or a chunk of text into the website, and it combines different measures to create an overall score. And ideally, health information should be written between a 6th to 8th grade level, and 6th grade is equivalent to year 7 in the UK. And lastly, we look at a tool to assess understandability, which is defined as, do people understand what the resource is meant to communicate? And we look at a tool to assess actionability, which is defined as, does the resource explain how and why to take action? And for these, I recommend the Patient Education Materials Assessment Tool by AHRQ, which is a government agency, and it has scoring checklists, which are very easy to use. After learning about these tools, the students are assigned patient cases or scenarios by the physical therapy faculty for the lab sessions. During the lab, which lasts for an hour and a half, which lasts for around an hour, students are put into breakout rooms based on the patient cases that they've been given. The patient cases focus on one of 4 conditions: stress, osteoporosis, poor sleep quality, and also pressure relief. And the students are assigned their cases through the online learning platform called EHR Go, which is an educational version of an electronic health record. Each case has 2 patient education resources associated with it for the students to review. One resource is intentionally more suitable for that patient, and one is intentionally less suitable. And these information resources vary from a Medline Plus page to a CDC website summary to a full PubMed academic article. And the students are given 30 minutes in their breakout rooms to use the tools presented in the guest lecture to assess the overall suitability of each resource by thinking about the patient's conditions, diversity-related identities and health goals, and then evaluating the trustworthiness, readability, understandability, and actionability of each information source in relation to their patient. Each student group is asked to select their favorite resource and be ready to justify why they chose that resource during a follow-up larger group discussion. As the students return to the main Zoom room from their breakout rooms, we use Mentimeter software to poll the students that are assigned to specific patient cases on the information resource that they're looking at using the following questions. Is the potential patient education resource trustworthy? What was its readability level? And what were the actionability and understandability scores? And finally, we ask which resource is most useful and most suitable for their patient, and then ask the students to feed back to the wider group about why they ultimately chose the resource that they did. Overall, each year the students have seemed highly engaged with the lab process, and I've received really positive feedback from the physical therapy faculty about how having a librarian collaborate on the workshop has been extremely useful in terms of being able to present relevant tools and resources for the students to apply to practice. This year was my 4th year doing the workshop, and I've noticed some common themes come up. First, when thinking about selecting patient education materials, students already seem used to considering patients' language needs, ages, and biological sex. The students seem much less used to considering patients' reading ability, health literacy level, and cultural identity. So these points are extra important to focus on during the workshop. And in terms of the workshop structure, assigning the guest lecturer as required viewing before the workshop seems to be the best approach, as the lab requires a lot of concentrated discussion time. And finally, another element that I felt my presence as a librarian really helps with is that students tend to be very unsure about how to assess resources for trustworthiness if they're not an expert on that specific health condition. But I always reassure them and say that as a librarian, it's part of my job to be able to evaluate whether the information looks reputable or not, and that I'm certainly not knowledgeable about each specific health condition, as I'm not a health professional. And this seems to help the students understand that practicing with the evaluation tools is the most important thing, as evaluating source suitability is a skill that can be developed. Thank you. I'm going to pass on to Lauren for our next case study.
Hello. Our next case study is going to focus on using universal design in a library-taught public health course. Oh, could we go back one? There we go. So first I wanted to give you a little bit of background about the course itself. It's called Finding Health Research Information and Communicating Science. It's a 1-credit course for graduate students in UF's College of Public Health and Health Professions. 4 librarians at the HSCL co-teach this course, which include Mary and our colleague Hannah. The course covers a wide variety of topics related to literature searching, data management, complex evidence synthesis, research impact, and ethical use of information. They first created a slightly different version of the course for the College of Medicine in 2016, then adjusted it for the public health audience in 2018. The course is designed to be semi-flipped with active learning during class sessions, giving students time to practice searching and other related skills together. In 2019, Hannah took a course on inclusive teaching from our campus's Center for Teaching Excellence. And when they taught the public health course that year, they tried to implement some related changes. The underlying concept driving these changes was the desire to incorporate universal design for learning, or UDL. The idea of universal design learning is that it ensures all learners can access and participate in learning without needing to request specific accommodations. This includes offering learners various ways of engaging in learning, displaying content in various ways, and focusing on thought over method of expression in student assignments. Another key takeaway from the inclusive teaching training was the idea of creating an inviting syllabus. The syllabus is students' introduction to any course and a key touch point that they can refer to throughout the course. So here are some ways of making a syllabus more inviting. Using warm language and phrasing policies in terms of what folks should do, not what they shouldn't do. Writing to the students, thinking about their perspective. Creating an inclusion and diversity statement and including your teaching philosophy, fully describing learning activities and assignments, and making sure the document itself is accessible, potentially with images. The next few slides will show examples on the left of wording in our original syllabus and on the right of how we modified it. In the first one, you can see that we use language saying what students must do related to email and had this warning that if they didn't follow the rules, we might not answer them. In the revised version, they clarify a little bit about how the course is set up and welcome emails from students, while still including the request to use their official UF email address. In this example, we talk about absences. In the older version, we lead the explanation of makeup work with a requirement of valid documentation, which could certainly be a barrier to some. In the revised version, we first assert that students will be able to make up in classwork, then clarify that they need to notify us in advance. This is probably the clearest example of incorporating universal design for learning as we focus on accessibility and potential accommodations related to disabilities. The older version focuses on the formalized process of requesting accommodations through our Disability Resource Center, registering and presenting a formal accommodation letter. In the newer version, we highlight our goal of making course materials accessible to everyone and offer the Disability Resource Center as a resource for further requesting specific accommodations. These next two slides are going to go together. In the original syllabus, we laid out expectations for students related to their demeanor, prohibiting specific activities like texting, looking for unrelated information, and talking on the phone. Again, it's framed as being about what students must do. And since this is a class for graduate students, this could come off as condescending. This diversity and inclusion statement in the newer syllabus is not a direct replacement of the student demeanor section, but it shows a focus on what our intentions are as instructors. We also included the opportunity to fill out an anonymous survey anytime throughout the semester to provide feedback for the course in a way that would allow us to implement changes if necessary during this iteration of the course, rather than waiting for end of term evaluations that could only impact future iterations of the course. Here is the content of the anonymous survey. You can see that we make a distinction between what we could do to improve the course this semester versus the next time it's taught. In actuality, none of our students have ended up using the survey, though they have provided feedback during a particular semester via email or one-on-one meetings. In the future, we could provide reminders throughout the semester about the anonymous survey to ensure that students remember it later on. Our main takeaway from this course is just an affirmation that the underlying philosophy of universal design for learning is useful for any instruction and can be meaningful whether changes are big or small. This project doesn't involve making major structural changes to the course, but even simple changes to a syllabus can make it more inviting and engaging for students and set a tone for inclusivity and mutual respect for the course as a whole. And finally, even if students don't choose to provide ongoing feedback during a course, giving them the opportunity to do so is still worthwhile. Okay. This next case study describes librarian involvement in a health outcomes and policy intensive course. In the first week of their second semester, first-year medical students participate in a week-long intensive course where they learn how policy influence health outcomes. During the week, students will spend each day from 8 a.m. to 5 p.m. immersed in the course topics. Monday through Thursday, they will have a combination of large group lectures and hands-on activities in their collaboration or collaborative learning groups. On Friday, the students present their projects to each other and selected College of Medicine experts. The highlight of the day is a series of expert panels discussing key ideas relating to how the U.S. healthcare system works and how it influences patients' outcomes. Students learn more about how the U.S. healthcare systems work, including topics like health insurance options, drug prices, and health disparities. Each patient scenario is designed to have students explore how patients' social determinants of health affect their access to healthcare as well as outcomes from that care. Each group is assigned to one fictional patient scenario. The scenarios provide minimal context and patient history, and it's up to each group to create the backstory and context for their patient within the project parameters that focus on how patients with low socioeconomic status navigate the system and their conditions. As part of the assignment, the groups will divide into subgroups for patient and provider and investigate the research questions from those particular perspectives. During these groups' usual meeting time, the librarian assigned to the scenario will meet with them and provide support with the research and their project in general. For these working meetings, the students are assigned the task of completing an information search worksheet assignment and submitting it for grading. Data from the assignment will be presented along with other details at the Friday poster session. The overall project goals are for students to develop at least 2 focus questions for their patient scenario, to frame an effective search for research and other reliable information, one addressing the patient perspective and one addressing the provider perspective. Use the principles for developing research questions that they learned in research foundations. This does not need to be a PICO question, but students must use similar principles and transfer knowledge of PICO searches to other topics. Identifying the types of information sources they think would be helpful. Some questions may not lend themselves to traditional literature searches and databases such as PubMed. And the next goal is to identify any questions they would like to ask the library liaisons and list them on the assignment worksheet document. And here are the scenarios. Each project workday, which is Wednesday and Thursday, there are usually 2 groups working on each scenario, and 1 librarian works with the groups assigned to a particular scenario. Since our involvement in the course, my colleagues have worked with the same scenario, the one with a 27-year-old with diabetes and depression. Liaison librarians are integrated fully into this intensive course. They attend the project Kickstart assignment session on Monday to be introduced to the students and on standby in case there are questions. During the Kickstart meeting, students will develop their patient's profile in depth and begin to consider research questions. Later in the week, librarians will attend the group leaders meeting to remind group leaders of the librarian-developed course resources and discuss how the librarians will interact with students during the hands-on activity sessions. Librarians are especially helpful during this time as the students are navigating information resources they don't typically use, especially the subgroup who is responsible for the patient perspective. On Friday, librarians will attend the digital poster sessions, especially for groups that they worked with. This helps provide the student presenters with a friendly face and allows the librarians to see how the project turned out while engaging the students in a discussion of their project and research process. If available, librarians can optionally attend the expert panel sessions on Friday and have reported value in hearing the discussion. The College of Medicine class liaisons who work with the Health Outcomes and Policy course created a tab on the LibGuide with resources specific to the needs of students completing the intensive course. It features links to traditional information resources as well as great literature links. It also provides access to instructional videos, public health data sites, local resources, consumer health resources, and information for specific ethnic and racial populations. While the health outcomes and policy course isn't necessarily described as a form of critical pedagogy, the course outcome focus on learning more about social determinants of health and how health disparities influence clinical outcomes. In doing so, the students learn about the grossly unequal access to healthcare and hear from the expert panels how most solutions involve some form of universal healthcare. This emphasis on exploring and solving unequal power structures is illustrative of what critical pedagogy seeks to accomplish. Librarians are involved in all aspects of this course, from course preparation and assignment creation to learning to leading group meetings when students are working on their assignment and project. This helps reinforce to students the idea that librarians are experts in information, research, and health literacy. As part of the project, students are tasked with examining the research question from not only the traditional healthcare provider perspective, but also the patient's perspective. The student subgroups who work on the patient questions have the more challenging position as they put themselves in a role they're not used to and have to remember that the average patient doesn't have the same health literacy or access to resources. Quite a few times, my colleagues have had to remind them that the patient subgroup, that their lower socioeconomic status patients wouldn't necessarily go to PubMed to answer their questions, and that they probably wouldn't be able to comprehend the research even if they could locate and access it. As the students navigate the healthcare system for the patients in their scenarios, they see firsthand how our system is skewed towards those with higher education and income levels who have health insurance. My colleagues have heard from many students. They verbalize their realization that the system is rigged against the poor, and as they hear the panel of experts say that the solution to this problem includes universal access to healthcare. Our next case study is case study number 4, which is critical librarianship and library workshops. Next slide, please. This research project seeks to investigate the impact of incorporating critical library research, critical library instruction theory, practices, and pedagogy in an academic health science center library instructional workshop. After the workshop, participants will be asked to take voluntary post-workshop assessment survey that evaluates the impact and attitudes concerning the critical library search example. The project began in January 2022 after obtaining IRB approval. The plan is for the project to run through the summer and depending upon the number of responses through the end of the year. So here's some background information about what critical librarianship and critical library instruction are. For this particular project, we focused more on bullet point 3, where we focus on we resist banking education, or as I like to term it, resist having the generic search examples that we use all the time, every time, and try to have search examples where we try to raise the critical consciousness in our students. So for our research question, for this project, my colleagues and I worked together to create a research question that would discuss an important healthcare disparity that greatly affects a minority population group. The goal of this question was to raise students' critical consciousness about this healthcare issue, while also teaching students the skills covered in the workshops, which are how to search a particular database and how to use different citation software. In addition to the question, the instructor also provided statistics that showcase the importance of this topic, which, as you can see, these are supplemental statistics. We also wanted to provide these supporting statistics and information to emphasize the importance of the question we have selected, but also simulate the research and literature process where we find information about our topic that informs our literature search. I created a post-instruction survey that sought to lay the foundation for this type of investigation and the incorporation of critical library instruction and DEI components. The survey seeks to try to see how the incorporation of the question impacted the learner's ability to focus, contextualize, understand the skills and concepts being taught. We also wanted to see if these questions were educating the learners about this particular health disparity. Then we wanted to see if they wanted to have more examples of the search questions in future workshops. So here are preliminary survey results. So for the first question, the database search example influenced my ability to focus and connect with other concepts being taught. As you can see, we have a majority of the respondents agreeing with this statement. We do have one responder who, as you will see, consistently disagreed with the particular questions being asked, but they also left a free text response, which we're going to go over, and it kind of explains their thought process as to why they disagreed. So I was very thankful for that input. Our next question, the database search example helped me contextualize and understand the skills being taught in this workshop. Again, the majority of respondents agree, and we do have one that strongly disagreed. Our next question focuses on awareness. So we wanted to gauge our participants' awareness about the database search example topic prior to this session. And as you can see, we had a mixed response, and so it was very helpful to see that our information presented in our topic was able to inform the learners who were not aware. Our next question, the workshop increased my awareness and knowledge of the topics that were used in the database search example. And again, we have a kind of mixed results. So we have a majority that agree, we have one that doesn't have an opinion, and then we have one that does not agree. So we have a strongly disagree response. For question number 5, we wanted to know if they would like to see similar database search examples used in future workshops, and majority agree. And then again, we have our consistent responder who strongly disagrees. Okay, for our next question, the database search example discussed today was relevant to my job duties, learning, and our research. We have some that agree, we have one that has no opinion, then we have one strongly disagree. So, and again, for our preliminary results, everyone was satisfied on some level with our training for that particular workshop, so that is a good thing. Yes, they're all satisfied. Okay, and then this is where we had our free text response, which was really helpful. And again, our strongly disagree participant decided to leave a free text response, which I was grateful for. And they are the first quote that you see. They thought the example was helpful for getting attention, but the level of discussion on the topic was low, and they thought it made the example seem irrelevant. They don't think that adding more statistics would be helpful about the purpose of the workshop. And again, this particular workshop that the participants strongly disagreed with was a citation management workshop. So I kind of understand their perspective. However, just as a devil's advocate, it did help them gain their attention. So slightly achieved. And then the rest of the comments talked about from our respondents, it was positive. However, we can't actually pinpoint whether they thought the overall workshop was great or trying to gauge if the topic that we use they really liked. So that was again kind of a struggle, but overall we had good responses. So that's good from a teaching standpoint. Okay, so here are preliminary conclusions and results. In conclusions, the results point to the inclusion of critical library instruction. It seems so far to have increased the focus of our participants when we're teaching our workshop classes. It also seemed to raise our participants' awareness of this health disparity search topic. Majority of participants would like to see topics similar to this included in future instruction. And then for number 4, applicability. Going forward, some workshops may not be applicable for this type of critical librarian instructional topic that we're trying to include. And again, EndNote and Mendeley and other citation software manager systems, you know, it may not be the best place. It was good to know. So. Okay, so in conclusion, this presentation provided an overview of our approaches to inclusive teaching, while also focusing on how these principles are being incorporated into a variety of sessions, including one-shot instruction, course integrated instruction, and credit-bearing courses. From each of these cases, we developed the following recommendations. The first consideration for inclusive instruction to support inclusive health science librarianship involves planning ahead to create common goals. So far, for the HSCL, it's been more of a piecemeal approach, but going forward, we are trying to plan ahead more holistically. We plan to talk about this at our upcoming faculty meeting and present our findings and our research. As part of the planning to create common goals, we want to make sure that everyone is at the same level. Secondly, it's imperative to confront implicit or unconscious bias when designing and delivering inclusive teaching. In each of our case studies, work was put into actively confronting bias in the design of either the entire course, as in the case with our credit-bearing course and standalone workshops, or with the library components of the course, as with our physical therapy and medicine examples. Going along with that, we also recommend moving towards student-centered or learner-centered language in planning instruction. In the credit-bearing course example, part of the purpose of redesigning a student-centered syllabus, using student-centered language was to help set the stage for an inclusive course experience. Our final recommendation relates to incorporating elements of inclusive teaching, whether inclusivity is the focus of the instructional format or design or not. As in the syllabus review and reformat demonstrated in the second case study, or in the content of the instruction as in the other cases, it is also important to incorporate inclusive content as illustrated with our example of the critical library instruction pilot project that seeks to measure the impact of incorporating healthcare disparity questions and other diversity, equity, and inclusion topics in our instructional sessions. Thank you so much for listening to our presentation. Does anyone have any questions?
Thank you so much for giving us a fantastic insight into the work that you do in Florida. Really, really interesting. I think the possibilities of decolonizing your search examples in that way and using them as two ways, learn how to search, but think about a different topic or a topic from a different perspective, or think about it from a different patient's perspective or a population group. Really, really interesting. So thank you so much. There's been some questions that have been coming through. I think one of them was touched on, you replied during the session, do you find students engage with flipped sessions when it's just a library session? And you responded to that, but I don't know if you want to talk a little more about.
Jean, I didn't know if you wanted to talk about it. I had mentioned in the chat while you were presenting that we do have some students who, I think like with all instructional sessions, we have some students who are engaged, but then we have those that are more passive. So what are your thoughts?
The advantage of the workshop that I collaborate on with physical therapy is that it's part of the students' full credit course, so they actually get graded on everything they do, so they don't really have an option, which helps in terms of like making sure they attend. Of course, it doesn't impact engagement. It still requires on them being engaged with the content. But I heard from the faculty member that since the librarians come on board with that workshop, the students have been much more engaged because of the diversity related content. They can see how it can impact a patient's everyday health behavior. So that was really cool to hear. Interestingly, maybe I did find that when I did the guest lecture in person, the students got overwhelmed with all of the health resources and all of the kind of assessment tools I was showing them. So I found that them viewing the video beforehand and then having the slides to refer to during the lab, which means the hands-on discussion part, has actually been really productive, and that's why we're going to stick with that format. And I wasn't expecting that necessarily.
Interesting, really interesting.
Thank you for the question.
It's a good one. Have you faced pushback to embracing a more progressive, critical approach to teaching, either in the university or more widely in the community?
That is a great question. I'd say
that's our attendees.
Yes, that's a great question.
Questions.
It's complicated at the University of Florida at the moment, and I don't know if you've heard about some of Florida's new laws that are coming in, kind of potentially prohibiting teaching on certain topics. So such as what's known as the Don't Say Gay bill. So that's going to prohibit teaching on sexuality and gender identity to children. We haven't seen a direct impact yet in universities, but it doesn't mean that we won't. So we're all kind of a little nervous about that. But in terms of the university itself, it's a very supportive environment, and there are a lot of grant projects and a lot of kind of instructional support for diversity, equity, and inclusion topics. I'd also say that from the perspective of our students, it definitely seems to make them mostly more engaged. We have a diversity, equity, and inclusion team at the Health Science Center libraries, and we've been doing lots of surveys over the past couple of years on kind of how our patrons think and feel about diversity issues. And there is always a subset of people that do not understand why libraries are involved in diversity, equity, and inclusion initiatives, and they think that libraries should be a neutral space. I believe that's the kind of viewpoint that comes across. But I think we feel like in the majority, people are very supportive of what we're doing. And then I just wanted to mention in terms of our colleagues, they're also very supportive, but we have been doing a lot of kind of professional development to make sure that everybody's on the same page with diversity, equity, and issues. So that was another aspect as well. Did you have anything to add to that, Lauren?
No, I thought it was very well said. And, you know, as Jane had mentioned, there have been some very concerning things coming out of our governmental legislator, and as well as from, well, not as much as it used to be, from our former president, but the support we have among our colleagues and among our administration is very reassuring during these tenuous times, so to say. But even though DEI work may be threatened, whether it's in an instructional session or DEI trainings for our colleagues, we do have support to try to counteract that and still do the work.
Challenging circumstances, my goodness. There's you think getting somebody to come along to a library session is sometimes hard enough, but then you bring in all of that extra political, oh my goodness. It occurred to me that at some point, when you raised the point about having to remind the healthcare professionals who you're teaching and the students who you're teaching, no, your patient is not going to understand that. Your patient's not going to go to PubMed. It's almost like the equivalent of trying to put them into, have you heard of things like arthritis suits or macular degeneration glasses? There's bits of physical kit that you put on to let you see what it's like to live with that condition, so that you can't bend your fingers or you can't see in a particular way. So almost to keep on reminding of them that no, they don't know what PubMed is. Why would they go to PubMed? Those sorts of things. It's almost, get into those shoes, getting to keep thinking of it from your patient's perspective every single time. I think it's really interesting stuff.
I agree, and that's why the scenario piece of the health literacy workshop kind of seems to work pretty well, because it keeps reminding students to kind of think differently and think as if they're the patient. So we've had some good responses to that.
Yeah, really interesting. There was a few points made. I mean, lots of very, very positive comments in the chat. There's a few sort of questions about sort of how to create inclusive examples for certain, because if you're just teaching a straight PubMed session, yes, I use heart attacks and chocolate, and is that going to prevent a heart attack or create a problem? But I could be using an example that, just as an example, is a more interesting topic, a more inclusive, creates it from a wider perspective. And I think having some sort of bank of those that we could share is almost would be a great thing, because it's a case of, oh crikey, I can't think what it might be because I don't know my blinkers and my biases. So having that example of the issues and challenges of barriers to maternity care for African American women is a really, really interesting one. And so thank you for that. Yeah, because I think that's a point that was raised, the struggle of trying to think about in questions that teach the skills but also get you to think about the question.
It definitely was a group effort from my team and the colleagues that worked with me on this, because you can think you want to do it and then you're trying to do it and you're like, oh, how does this fit in? And then I worked at a cancer center library for 5 years, and so my canned search examples are all cancer related, and so it's just easy to fall back on what you know, and what you know works. So I will say it's worth the effort to try to change your instruction if you can.
Yeah, fantastic. There's a suggestion you could get students to search for a topic that they don't understand, astrophysics, just to get them into the point of don't understand the stuff that's on the astrophysics journal versus astrophysics for dummy or whatever it is that we go to. So yeah, searching for a completely different topic. It's just, yeah, remember not knowing anything about your particular specialism. Super. Thank you so much for joining us this morning. I really, really appreciate your time, and I hope that the rest of your day goes well. There's been so many great comments and thank yous and thought-provoking and all the rest of it in the chat, and I hope you've been seeing that as we've been going along, because we really appreciate you joining us today.
Thank you so much for the opportunity, and if anyone has follow-up questions, we did put our email addresses on this slide. So
Superstars.
I'd love to hear from you.
Thank you so much. Please, people, fill in your evaluation forms when they come through. Show these people the love. Tell us the sessions that you would like to hear in future UHMLG courses and events. Thank you so much for everybody's time this afternoon. We've had 3 amazing presentations by great speakers, so thought-provoking. I'm just jammed with ideas. Do give us lots of evaluation when the feedback form comes through. Do please tweet if you get the chance for today and also for tomorrow. And do also think about coming along to our in-person event in the summer. We are meeting face-to-face for the first time in a couple of years, and the sunny Swansea is going to be the venue. So do look out for the details about that event when it comes through. It would be really nice to see you all face-to-face in due course as well. We are just about at the end today, but final big thanks to the committee for organising this. They've done some great work, to our speakers who have all been amazing, and of course to you, the audience, because of asking all of those really thought-provoking questions. It just turns it into a conversation, and I think that's really, really valuable in these times. If you like the look of UMLUG, and we're always interested in new committee members. We lost Ian Baird earlier in the year. He stepped down from the committee. We gained the fantastic Catherine Peppard from the Royal College of Nursing earlier this year as well. If you're interested in UHMLG, fantastic bit of CPD, great crew to work with and to collaborate with, and you get to be part of sessions like this as well. So if you're interested, do get in touch. In the meantime, thank you all for joining us. Enjoy what's left of the afternoon, and I do hope that we'll see you again tomorrow.